He is a doctor of internal medicine, fondly known to the internet as MD with Spirit. If you are not following him on YouTube and Instagram, go ahead and find him on his handle right there. It's MD with Spirit, and go give him a follow both on his channels, on both channels. He shares some fun, witty wisdom, health wisdom with his signature humor. So you don't want to miss that because that's something that we all need more of in our lives. And so, Dr. Phan, welcome.
Thanks for having me again. I guess I wasn't so bad the last time, huh?
Oh no, you weren't that bad the last time. We actually loved having you. There was so much positive feedback. I'm just giving a quick um, uh, post on Instagram stories because I promised people I would let them know as soon as we are live.
Right.
So people are starting to jump on. We have a bunch of questions, and
Well,
so
let me answer the real quick. I do telemedicine. If I do consults online, I'm trying to keep it low, but I do consults as a health coach or health practitioner, but not as your doctor. If you come and see me in person, I can become your doctor. It's just a matter of liability, and I want it that way because I can examine you. I can't examine you online. Uh, we don't always need examinations, but it's just safer that way. And so I kind of split my online consult medical medium stuff with my conventional practice. Now, if you come and see me in person, we can talk about medical medium stuff, but we're not going to have 2 hours to speak or an hour to speak as much because it's a regular functioning clinic and people are getting in and out. So that's the split between. I do take most insurances. I don't take most HMOs though. So you'd have to call the office, and I'm in Spring, Texas. And the number, if you want, is 281-376-2200. And that's the front of it. Now, if you do online consultation with me, there's a different form and a different process so it costs more too. So see me in person is cheaper.
i.e., if you're in Texas, go see him in person, and if you are out of state, I have many clients who have actually booked consultations with him, um, and gone and flown in to go see him and have made them their primary doctor. I'm just posting his phone number for his office right here. So
Yes,
that's
the
his.
376 stud was taken, so we had to settle on 2200 instead of 376 stud.
Well, Dr. Fan, so you need it in your phone number.
There we go. Yes.
All right.
Right.
So our first question here is from Karen Churchill. She says, I have a question. Can a person who is on thyroid hormones due to a total thyroidectomy, can that person eat grapefruit while on Synthroid or Eltroxin?
Yeah. So I think you can, because the fear is that taking grapefruit will increase the levels of levothyroxine in your system. But how does it do that? We don't really know. Perhaps they say it inhibits the liver enzyme pathway. Um, if you want to get off thyroid medicine or reduce it, at least you're taking grapefruit on a regular basis, then you would actually need less thyroid medicine, theoretically speaking, right? Because if grapefruit increases the levels of it, then you take less of it. So that might not be a bad thing. Is the grapefruit releasing thyroid hormone from your liver that you've had for 20 years or 10 years? It's like squeezing out. I don't know. Maybe that's the mechanism if we were looking at a medical medium standpoint. But I think you can, as long as you stay on a kind of a steady dose, and it isn't, you don't just like have 20 grapefruits all at once. It might be something that you can do.
Yeah, I mean, that's a medical opinion, right? So you have it right from the doctor. Why is it that they tell you not to have grapefruit, Dr. Fan?
Again, because it can interfere with the metabolism of the drugs, so to say, and you increase levels of levothyroxine, so you might getting too much, right? For the most part, most people, if a little fluctuation, no big deal. But if you feel like, oh, I'm having palpitations and kind of hyperthyroid, okay, maybe you should cut back on the grapefruit.
Okay, nice to
But as
hear that.
always, talk to your doctor, work with your doctor. I'm not
Yeah.
your doctor at this point, so
Yes, exactly. So if you all don't know, if you are not signed up for this, the Ask the Doctor panel starts tomorrow. We have our first call with Dr. Phan, Dr. Joy Clark, Dr. Kibele, and Paul Bennett. So if you have not signed up to that, I highly recommend that you check it out. I'm putting I will post the code in the corner right up. You can go ahead and I don't know why it's doing that. Does it show up? Can you see it?
I don't see it. But in the chat, you mean?
No, up in the corner of the screen.
Here we go. It's the QR code.
Yeah, do you see
I
it?
see it. I see it.
All right. Okay, I'm gonna
Somewhat blocked by the live and the live thing, but I don't know.
the code right up there, guys. You can just tap on it or click on it, and it will take you to the program that you can join and actually ask much more in-depth questions on the live than you get over here, because you know we're limited. It's social media after all, and they censor us for just about everything. So getting the information out is kind of hard here. So I just want to make sure that you guys all see that. Can you all see the code? Because I cannot see the code, which is really weird. So I hope you guys can see it, and I hope it's working. So our next question is from Andy Rue. Says, should I take seizure medication or push through on protocols? I've been on protocols for years, but picked up new viruses a year ago, which I feel kickstarted the seizures and my ALS symptoms.
That makes sense. I mean, I would think that any stressors would kickstart the seizures. I would probably keep on doing continue the seizures. If you're seizure free for a period of time, you can talk to your doctor about maybe reducing the dose and seeing if it's okay, because a seizure is pretty stressful on the body. And if you're already on it, then I wouldn't necessarily stop cold turkey and just because I want to be medication free. I think there's probably a gradual reduction or trial period that you can try.
Yeah. I do think it can be important to be stabilizing. So if you're having seizures, say once every couple of months, it's not a lot of seizures, right? But if you're having a seizure every week, stabilizing yourself with a drug can be really important. And I mean, Dr. Phan, let's talk about this whole topic of stability. I mean, I mentioned it last time as well. Why stability is so important?
Well, I mean, for instance, in this case, right?
Before we dive in, before we go into it, what does stability in the body, what does it mean?
So I don't know what the answer I'm going to give is what you were looking for, but it means that things are they're not being exacerbated by other things. For instance, like viruses, and you're having a flare or something. Because in that case, you work on the flare. In your case, Andy Rue, I would work on the viral stuff first. That's where your energy should be focused on. Because if your body's not stable, how are you gonna get off the medicine or reduce the medicine at all? You want to really knock down the viruses first. Stability means that the body's working well. It's doing its thing, and it's not being thrown off by a seizure or by a adrenal stressor.
Yeah. So you're definitely on the right track, and I think you've heard me talk about this before. So I would say like focusing on blood pressure, blood sugar, blood temperature, or temperature, body temperature, our blood hydration levels, all the things that we can kind of measure and track. I think they're important to consider in the stability question, plus pain. Like if you're in extreme pain or you are not sleeping, if you're getting like just a few hours of sleep a night and not getting enough rest and you're waking up exhausted day after day after day, all these things will reduce your stability. If you're not eating, if you're throwing up a lot, if you're nauseous and you can't eat, all of these things will cause your body to become a little unstable because you're not able to maintain your blood sugar, you're not able to counteract adrenaline, well enough, you're not able to keep the body stable inside. And I think anytime the body becomes unstable, we anyway produce a lot of adrenaline, because that's what happens, right? When we become unstable, it's fight or flight, and it kicks in to help us make a better choice or decision in the moment. So, what would you say in light of what I just shared?
So, yeah, I mean, I totally back you up. Basically, if your adrenals are going, you're feeding something else, or you're gonna have a hard time recovering. So,
Yeah.
that's that.
Yeah. So, why, for example, seizures obviously make a person completely unstable. They lose their body integrity. They lose control. So why would it be important for someone to come off, if you had a seizure once a year, would you want to be on seizure meds, or what would you say?
Okay,
Or
so it depends what if you're a person who like drives people for a living, you got to be, you have to show that you're not having seizures and stuff like this. So yeah, I mean that's important. You pass out while you're, if it's only a seizure you have at night, or you can tell it's going to happen. Maybe once a year is not bad of a price to pay. And then you can think about doing the protocols more, and getting off the medication. But I think you always worry the benefits and the risks of a medication, and if it's stabilizing you, then you keep on it, and then you come off later on. Work on for Andy Root, work on your viral stuff now, and it will come in time, hopefully.
Yeah, especially if you have ALS symptoms, you got to kick them really hard, because ALS is a serious diagnosis, and you don't want to mess around with that one.
Yeah.
Okay, our next question is from Brents. Brents, welcome, Brents, to our call today. I hope you'll check out our program, because you can ask a lot more questions, get more in-depth answers there. Ask the Doctor starts tomorrow. So Brent says, I recently came off thyroid meds, T3 only. I've swelled with 6 pounds of water in 9 days. I feel fine, no return of hypo symptoms except water retention and slower pulse.
Wow. Yeah. So I've had patients like this who came off their thyroid medicines, sometimes abruptly, sometimes not, and they would have symptoms of classical hypothyroidism you learn in medical school, with swelling and fluid. The concern is that the fluid is building up and is going to build up in the lungs, and you're going to have a shortness of breath. And in one of my patients' cases, she had to go to the hospital to get the fluid off. So I would say maybe you go more gentle. Maybe you consider T4, because the hope is that you convert a little bit if you want to kind of go somewhere in between, or you do a little slower, because T3 is much more powerful than T4. It's like 4 to 5 times more powerful than T4. So maybe consider either getting back on the T3 at a lower dose to get some of that fluid off, so you can be more comfortable in your body, or think about T4 by itself, if you can do that.
Okay, that's great info. Another question's from Tammy Chapa, and she says, is there a prescription thyroid medication that you prefer? I already understand the root cause of thyroid problems. This question is for those who will eventually wean off of it.
I used to like, the peak thyroid before I knew about Anthony's information, and later on we find out that thyroid hormone itself can actually feed viral stuff. You can actually run your adrenals if you're taking too much T3, and a lot of women come asking for T3 because the doctors won't give it to them. And I used to people coming from out of state coming to see me for thyroid, because I've been doing it for like 16, 17 years now, and I do any type of thyroid. You like NDT, T3, T4, compounded T3, T4, T3 only, T4 only. I mean, all sorts of stuff. And if you're working with a doctor, I like Tirosint. Tirosint is a brand name, levothyroxine. It's a cleaner version of it. It might be more expensive than even compounding T4 alone. So you can consider Tirosint written by your doctor, or compounded levothyroxine, that's a cleaner version of it. So Synthroid, you've heard of Synthroid, you've heard of Levoxyl. Synthroid is a bit more expensive than generic levothyroxine, and it's gluten-free, but it's not necessarily corn-free or metal-free, titanium dioxide and all these different things. So these are some things to consider when you're doing that. Tyrosine solution is a liquid, and it's comes in a plastic vial. You just drink it basically. So there's even less fillers and binders and stuff. So those are the ones if you could do that. Some people feel the difference because of the gluten or the whatever else fillers and binders that are in there.
So you're mostly it's just gluten free, but it's not totally clean. It's cleaner, not clean.
Well, tyrosine is, I think, corn free as well.
Okay.
Of course, I think it's vegetarian, so there's no pork in it, and it also might be. I'm not sure. There's some ingredients that Anthony says you can never know. They never list it.
Yeah,
So,
true.
but I think it's probably the cleanest of the commercially available levothyroxines.
Yeah. So also I would say, um, is it possible to get really clean supplements or medication compounded so
I
that
think
they
it is. The issue that I'm not sure about, and I need to investigate when I have like 5 seconds, is the stability of it. How long can it last? So if you've ever gone to the pharmacy and like, well, my kid's taking this antibiotic, and if you put some strawberry flavoring in it, right? It can only last so long. The solution lasts so long outside of once it's been mixed up, right? So the question is whether these compounded, if you let's say ibuprofen, can you get or Tylenol, can you get it compounded without dyes and fillers and binders? I think there's probably a way to do that. Um, the compound pharmacies always have to show that there's a reason why they're using something that's commercially available and compounding it because of allergens, like a patient has a certain allergen. So you could get away with saying, yeah, because I'm allergic to most dyes and da 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 da, so I need to compound this Tylenol. But again, the cost is exorbitant compared to a $3, generic version you get at your local grocery store. So it could be $10, it could be $20, it could be $30 for 20 pills or 30 pills. I don't really know the cost. But if anybody's in the pharmaceutical industry and wants to kind of think about creating a clean ibuprofen or a kid's version of it, let me know.
Yeah, I mean, I think Genexa has done somewhat of a decent job with some basics, but
Yes.
they are loaded with flavors.
Yeah.
They have flavors and everything. It's just so annoying. So I hope, I hope that
I'd be happy as a parent having a clean version and I can mix it in some juice. That's fine with me, powder even. But I
yeah.
don't know that they're available. If anybody knows that, I'd love to figure out how to do that for people. Thought about contacting a compound pharmacy and like, hey, can you do this for my patients and send them there, and some people would like to have some on hand.
Yeah, exactly. That's really helpful to know that it can be done. But again, they need what they call a valid reason, right?
Yes, yes.
Yeah, I know. And is that valid reason a true allergy? How do they assess that?
I mean, basically, it's kind of the honor system that the doctor has to write, this is why, or the patient has to tell them that's why. What they could get around is like, let's say you do Advil with the B12. That's something that's not in usual Advil. So he's like, this is a proprietary formula. And that's why how some of these patients who are these compound pharmacies are doing like those Empic generic, they're putting semaglutide with something else and saying, this is our proprietary formula.
Right,
So
right. So I have a couple of questions. One is about blood thinning, and the other is congestive heart failure. So let's pull up the congestive heart failure questions by Laura Pook or Puck. Um, Congestive heart failure. So before you go into the question, maybe explain to the audience what congestive heart failure is and why she's worried about sodium.
So congestive heart failure is a heart condition related to the inability for the heart to pump basically adequately to produce to basically the blood throughout the body, right? So you can have it can be caused by atherosclerosis, heart disease. It can be caused by viruses. Long-term high blood pressure, from the conventional standpoint, is a cause of it because the damage it does to the walls of the vessels and stuff like this. So those are some. There's congenital ones. There's also this is kind of an umbrella term for when the heart's not pumping right, basically, whether it's systole, where the heart's pumping oxygenated blood, or diastole, where it's relaxing and filling it with blood. There are different versions of that. So that's a kind of a generic term. One of them would be like postpartum myopathy, where after you're having a baby, your heart doesn't pump as well, and then you have to basically take measures in order to get the fluid out. So that's what, in a nutshell, congestive heart failure is.
Yeah, so basically it's the inability of the heart to pump as well as normal, right?
Yes.
Um, so should she be worried about sodium in celery?
So I would not. In fact, I think it would be beneficial because look, I mean, if your liver is not is gunked up, is sluggish and stagnant, celery will help that a little bit. And the sodium that you get is not sodium chloride. The sodium in celery is not sodium chloride. It's the Anthony talks about the sodium cluster salts, basically that kind of work in a certain way to help kind of latch onto things and grab things and pull them out, basically. And so I don't think you have to be worried about that. Now they will tell you that you be careful about how much fluid you take in. And again, if you can handle it, I don't know, maybe you can do 16, maybe you can only do 12 or 10. You have to go to the level that you can take and not get significant symptoms of swelling and shortness of breath. Because ultimately, what congestive heart failure causes is a backup of fluid, and that fluid will back up into the legs, into the lungs. So you get shorter breath. Maybe you lay down and you're more shorter breath because as you lay down, the fluid goes. So the treatment typically is to pull the fluid off and restrict salt intake, but sodium chloride is what they're talking about because sodium chloride holds on to fluid. You retain water, right? That goes with pickle juice or any of these foods that are highly salted and stuff like this. If you're doing medical medium, you're probably not doing that much salt. I mean, you probably are, but not that much. And so using sodium cluster salts, not sodium chloride from celery, is advisable to me in whatever amount you can take.
Yeah, I would say the same. And congestive heart failure, you know, according to medical medium, again, it can be viral. It can be a lot of, it's definitely connected to the liver, as Dr. Phan said. And since celery juice helps the liver so deeply, it's one of the top recommendations for liver support. Um, I would highly recommend that you do that. And also, um, adding to that, if you haven't considered hawthorn berry is very helpful for all things to do with the heart. It protects the heart a lot, and any kind of congestive heart disease issues, hawthorn berry is super helpful. So if you, I mean, this is of course in addition to a whole protocol, but you know, start there. I hope that helps. All right, our next question is from Facebook, which I want to share. It's about blood thinning, and she says, Anthony William talks about thinning your blood naturally rather than going on blood thinners. How do you know when the blood is thin enough and safe enough to get off blood thinners? Now, this person who's asking, I know her father is on blood thinners, so I think that's where the question is coming from.
Traditionally, they use, oh, sorry, traditionally, when people are on Coumadin, which is an old blood thinner, they may call it rat poison, it thins the blood, and they use a test called the PT-INR. Unfortunately, well, not fortunately, but fortunately, the new tests, the new drugs don't require to use the PT-INR because Coumadin is very specific and it can interact with a lot of foods that we eat that are healthy for us. And so these new drugs, these novel agents, they don't rely on they're not affected by the dietary changes. So but how can you tell? You can't check a PTINR. There's some other tests you can check, but they're not easy to come by. So sometimes they fail too. So it's really hard to know what the natural stuff we're using is gonna like thin your blood to even measure. So it's really hard for you to say that. I mean, if you haven't done it, then you go plant based. You reduce the amount of fat in your diet, and that's usually gradually. You have to do that. And, taking fat away right away is difficult for a lot of people, and they crash if they don't get enough calories. So I can't tell you there's a reliable way to say this is I'm bleeding easily now, so I cut myself easily now. I'm bleeding easy. It's just hard to know exactly that you won't have an issue with the clot, because if this person is on blood thinners for a blood clot or atrial fibrillation, um, doctors are going to really cover their butt and try to put you on something.
But I mean, that said, it takes time to thin the blood.
Yeah.
Like with liver stuff, you can't thin the blood overnight. It's not going to suddenly become thin, even in a few months of using the right tools and getting in the hydration and what have you. It takes time because all that old fat and grease that's stuck in the organs and stuck in the, you know, tissues of the body, that will start to slowly release itself and eventually come out. So whatever you remove from the blood with the tools, you'll get more sludge coming in because it's going to pull it out of the body from various places. So it takes time.
Yeah.
Wouldn't be in a rush to figure that out. And I think that I mean, Dr. Phan, if, say, someone who has thin blood or normal blood, if you put them on a blood thinner, would that thin them too much and you'd see like bleeding or internal hemorrhaging or
You
bruising? I
could,
think.
yeah, you could. I mean, here's the thing: blood thinners don't cause bleeding; they make bleeding more prevalent, right?
Easy.
So, like if you've already got a little bleak, it's gonna bleed it more. So there was already something there,
Right.
but it's gonna bleed more. Whether you have a hemorrhoid or you have a small little arteriovenous malformation in the vessel somewhere, but you don't really know because it's you don't see it. For instance, the blood will make it more thin. You'll see it if it's there.
Yeah. Yeah. All right. Our next question is another question about sodium. I'm testing very low sodium blood test. Do you know that the type of salt used and tips for chronic dehydration? I have been following for over 4 years and don't eat salt. Question. For those of you who have just joined us, Dr. Phan is answering questions that are being posted into the chat box here on the side. So go ahead and put them in. And I'm pulling questions from our Facebook and Instagram threads as well for people who posted earlier. And if you're interested in knowing more about, connecting with Dr. Phan and other doctors in the medical medium community, getting answers from doctors in the medical medium community, click on this QR code right here and check out our program. It starts tomorrow. It's the first live call. So Julie, your question is, I'm testing very low in sodium on the blood test, Dr. Phan. So what would you say about raising this sodium level to a more normal level? So I guess one of the questions I have, are you low and within range or are you out of range? So if you're listening, Julie, let me know.
Well, Julie, we see a lot of this a lot of times, low sodium in patients who have or clients who have adrenal fatigue, severe adrenal fatigue, right? So your body's using the sodium to produce other things, and you want to bring the sodium back for sure. But again, not necessarily the sodium chloride, the salt. You want the other forms of sodium, and it takes a long time. It's not something that gets done like in 2-3 weeks or something. It takes a long time to get that right. When doctors see low sodium, they call it hyponatremia. They will tell you to stop drinking a lot of water, a lot of fluids and stuff, because they want to contract your volume so you don't dilute your sodium as much. And that's not really conducive to the medical medium lifestyle. Instead, you work on the adrenals. You bring in the sodium cluster salts and other sources. Like you like dulse, have at it, and it'll give you some other ways to get some of the sodium in your body, but it will take some time. And you don't just it can be discouraging if you're like, I'm always low in sodium. And but again, I don't know your whole case. I don't know what medications you're on. Sometimes medications can do that, but I'm assuming you're maybe not on diuretics. But doctors call it SIDH, a syndrome of inappropriate ADH secretion, when they can't figure it out. And they think your brain is reset to a lower sodium level. The reason why sodium being really low is dangerous is if you go from normal to really low fast, you can have like seizures and other bad things happen to the body. So when you have a long-term issue, it's most likely we're seeing that conjunction with adrenal fatigue, even neurologically.
So, I mean, with low sodium, like Dr. Phan said, even in my practice, I see it a lot in people who are really, really adrenally fatigued. And the way to bring it up is you need more mineral salts. Actually, one of the things that you probably crave are mineral salts, right? You crave salty food. Julie's saying it's completely out of range, so she's off the charts. So, yeah, so you want to build more, leafy greens in the diet, spinach soup, maybe a double celery juice, or maybe a celery and a cucumber juice every day, or it could be any any kind of mineral salts that you can focus on, adding in more sprouts, adding in more fresh greens, more arugula, nerve shifter shot, also super helpful for that. So building in more adrenal snacks and more greens will help do that. And on a fun note, Dr. Phan, I thought I would have to share this comment with you. Um, right here.
Oh yeah, you like my wig today? I put my wig on today, so it's like I'm trying. Thank you.
Hey, Andrea, thank you. We see your comment. Okay, our next question is from um, where to go? Where to go?
Um,
They disappear sometimes. All right, so here's another one. Here's a good one. So I've been off of prednisone for the past 2 years, and I'm still dealing with moon face and abdomen swelling. I have been working on my adrenals with all the protocols. I am told I do not have Cushing's.
ooh, that's difficult, right? It's long term. They can't find anything, and then it's still. I mean, are you having adrenal issues as well? I mean, it seems like that that's basically what we need to do, but it's hard because adrenals take time to heal. Because I think have I said this before? Just suppose that you have a waterfront property, and every year hurricane season comes, it floods the whole house, right? So this year I'm gonna put like sandbags all over all four corners of my house, 15-foot raw, and this is your supplements, your protocols, right? But when the storm surge comes next year, it's like 20 feet goes across that. The storm surge represents your adrenal stress, and it can overcome your supplements and your regimen and stuff like this. So what are we doing in terms of our stress? Some people you can't avoid that. You can't avoid like your jerk spouse, ex spouse, or whatever job demands. So you have to do the best you can, and it takes time for this, right? Remember, Anthony talks about how long it takes to heal, and you have to kind of visualize things and just know that it can happen, right? So we have to give it time. You can also use is it chaga that we're saying for that could be as have a little bit as a little bit of a steroidal effect kind of
It
help.
has that hydrocortisone effect,
Okay, yeah. So
the
yeah,
steroid effect. Yeah.
yeah. So that could be helpful in regard if you haven't added that.
Yeah, that's super cool that we can use our tools in this way and that we have medical medium information actually helping us with this. So I hope that you can wean off and use other tools, other, you know, um, medical medium information to help remove this from the body, like pharmaceutical exposure shots and
Yeah,
toxic heavy metal exposure shots and the advanced heavy metal detox smoothie and the extractor smoothie to really start to pull out these deeper layers of prednisone in your liver. I used to have that too. I was I actually my weight issues all started when I went on heavy doses of prednisone when I was a kid. And I would blow up and come back to normal and blow up and come back to normal, and it's just been a long process for me as well dealing with prednisone. And I used to have prednisone shots because my asthma and allergies were out of control. I had nothing could control them. I would end up in the hospital unable to breathe. And so I had to go on long-term steroids. And so I would say that keep working with the adrenals, keep supporting the adrenals, keep taking care of them. Adrenal fight or flight stabilizer shots are good, but a lot of you're gonna have to do a lot of cleansing. A lot of cleansing will help to remove that out of your body. So I hope that's helpful, Autumn. Thank you for your question. We have another question from Marie Milkiewicz, and she says, "Can you cure an infected tooth um, without a root canal? My tooth doesn't hurt or anything, and the dentist found it while doing an X-ray." Um, I know you're not a dentist, Dr. Phan, but what would you say?
I think you probably could, but you'd have to go really intense, and I think you have more experience than I do with this stuff as far as the dental things.
Yeah, and I would say for sure you can. I've helped many people be able to deal with their tooth issues and not have to uh, not have to do a root canal or not have to take drugs or um, any of that. We are able to use the tools to help you. If you have an infected tooth, then I would recommend swishing with celery juice, bringing in things like golden seal, garlic, the turmeric garlic shots, and swishing with them, but without knowing where the infection is, how deep it is, where do they see it in the x-ray, how long have you had it, are you seeing visible swelling and pussing, or there's so many more questions that I would need to ask you to answer that question. But in a short answer, yes, you can. Many people in the community have been able to do that. All right, our next question is from where is it? We had one from Vicky Russell, which is a good question I wanted to
Yeah,
bring up.
I saw that one.
Uh, he's asking about your opinion. Um, it's about IVIG for motor neuropathy. Your opinion on, let me find the question. What is Dr. Phan's opinion on IVIG for motor neuropathy? I believe that was the question.
Yeah,
I'm trying. As soon as I find it, I'll put it up on the
it's on
screen. But
Facebook. I see
yeah.
it. Yeah.
Oh, it's on Facebook. You see it. Okay. Yeah.
What did Dr. Fan say about using IVIG for multifocal motor neuropathy? So
Right.
the thing with IVIG is that it's been used a lot. When you're like sometimes like I don't know what to do, the neurologist is like, let's just throw some IVIG at it, right? Here's the
Yeah.
thing though. I think it can help maybe like temporarily, but long term, where do they get the IVIG? IV intravenous immunoglobulin, right? Where do you think they get it from? It's probably pooled from other donors, which are
Yeah.
young college kids get giving blood for like, so I get some pizza, man, I need some food, I'm gonna give some, and they're pooling this they say young healthy donors or young healthy donors. They're screening for HIV, they're screening for hepatitis B and C. I don't know if they're screening for herpes 1 and 2 or Epstein-Barr virus, right? So could your IVIG possibly have a little of these floating shingles or Epstein-Barr, and you're going to be exposed to that? Possibilities there to me. And so, we really want to work on protocols. If it really worked temporarily, you needed to save a life or something, or get you out of a acute crisis, whatever works, throw the kitchen sink at it to get you stabilized. But once you're done, you try to work on the protocols so that you don't have to keep on getting exposed to it. Because I think I've identified a couple people where they're getting worse, and because they're trying to marry both medical medium and what their doctors in front of them is saying, and they're not listening to me. I'm like, look, you don't want to do that because long term you might be it might be detrimental.
Yeah. It's a tricky one, Vicky, because Dr. Phan, have you ever seen IVIG actually resolve an issue it's given for?
No, I don't. I haven't seen. I mean, I've had some cases where I'm.
Yeah.
You know,
It's a it's a therapy that some people can say, like, look, Vicky, if it was like, take Synthroid and we know that you will stabilize because your numbers will stabilize, it's pretty clear cut, then you could do that, right? But it's something that's doesn't have a foolproof, it doesn't even have a track record of showing drastic improvement. And nearly everybody that I know who's taken it, they'll stabilize maybe for a little while, but then all the issues come back. So it's tricky. I don't want to say, I'm not a doctor. I'm not going to say don't do it. I'm just sharing clinical experience and observation from people who have done it. And Dr. Phan also doesn't seem to agree. So,
I don't prescribe it. I just see patients who get it from specialists like hematologists or neurologists and stuff like this. And my notion is that there's something more that we don't know what's in it. You don't know what's in it. You don't know if you got it from this, again, some college kid is trying to get some pizza money.
yeah. Yeah. All right. Our next question is from Amira Ali Dixon, and she's asking a really good question that I think a lot of people have. It's a very common question.
Yes.
I've been showing high B12 levels in my blood work. Should I be concerned? What does this mean? How can I fix it?
Anthony wrote, I think, something about it, a little blurb about B12. You will have high B12 levels once you start that Vimergy B12, adenosylcobalamin and methylcobalamin. This is how I say it to people. It stacks up in the blood. But you don't know what's happening in your cell unless you take the cell out, which is a biopsy or an autopsy, and none of those are convenient to you, right? Because you're seeing what's in the blood only. You don't know what's actually getting into your bloodstream. If your liver is congested and stagnant, sluggish, it can't take that method, B12 and put it into the cells for you. So it's like having an Amazon truck stuck in traffic, waiting to deliver the goods to your house, but it can't exit off the road because it's stuck in traffic to give you the B12, give you your order basically. So when you see a high B12 level, it does not necessarily mean that you have a lot. It may mean you're deficient in the cell, actually, is what Anthony says. So it's a water soluble vitamin. It's not going to cause damage like as much as a fat soluble vitamin takes that can stay there for a long time and take time to go down. So I think I routinely see high levels of B12 levels, and you'll hear from other doctors, "Get off that B12. You're on too much. You're going to cause yourself." And no, you won't. Now, if you're taking crap B12, cyanocobalamin, cyanide, maybe, but especially if you're taking injections too, you're going to see high levels, and you think you're good, but it's not telling you the whole story.
So I just want to point you in the direction of the Brain Saver book, Amira, because in the Brain Saver book, chapter 39 of the first book, Anthony talks about this exact issue. And he talks about why B12 levels show up high in the blood. So let's talk about why. So hopefully this will be educational for many who are listening, because this is a common problem and a lot of people do not understand why this is an issue. So the reason this becomes an issue and why you see high B12 levels in the blood, just like Dr. Phan said, it's like the B12 is parked on a highway and it cannot get off and get into a cell. But what prevents that? What prevents the B12 from getting off the highway and into a cell? It's high blood fat levels. And what he says in the book is that when you see high B12 levels, that means that your cells are deficient, that you're not getting it in the organs, you're not getting it at the cellular level because it's being blocked by high blood fat. And some people will say, oh my gosh, I've been on low fat diets for like a year already and I'm taking care of myself. And so why am I still feeling this? Because, like I mentioned before, sludge takes time to leave. So you could have high blood fat for the whole time that your body is removing excess fat from the brain and excess fat from the liver, and like a fatty brain, fatty liver, fatty spleen, fatty kidneys, all the places that fat is stored, right? And so it's going to slowly leave and you're going to still experience those higher blood fat levels and higher B12. But that doesn't mean you lower it, because if you lower it, you really won't get any, right? But it just takes more time to get to the cells. Now, he does say that when you lower fat for a considerable amount of time, then you'll notice once you have blood fat levels that are normalized, that there's not high blood fat anymore, you'll notice that you'll dip and become deficient in B12 in your blood. And the reason for that is now there's nothing blocking the highway and for the path to get B12 into the cells and into the organs. And so because there's such a deficiency in the organs, it just sucks it all in. It sucks it all in. You won't be able to take enough B12 orally to maintain the blood level. Once you have upped your organ levels of B12, then your B12 levels in the blood become normal. Then you have enough B12 in your. But if it's happening in the early days, first year, second year, like this process could take years. It'll take years. I mean, like there are, people we know in our practitioner group, right, Dr. Phan, who have been fat-free for like 5 years. And they're like, my cholesterol's going up. My, triglycerides are going up. I don't understand, because they are being removed from where they were stuck in the organs. And that's why they're seeing it go up in the bloodstream.
Anthony has talked about that. He likes the fat to be floating around rather than stuck into the vein, into the liver, and things like this. And I kind of liken it to like use those those cartoons in the old days where people coming over and everybody's going to clean up the house. They throw everything in the closet and they stick that chair in there to kind of like it's bulging out. So if you take a medication, you're gonna statin drug, you throw everything into the closet, and then you're just waiting for that chair to break and everything come out, right? So he likes it floating around rather than stuck into one area. But of course, that's not what conventional doctors will tell you.
Yeah. So Another related question is, what is the normal B12 range?
Well, on the lab work, if you look at LabCorp requests that I use typically, you'll see anywhere like 239 to like 1200. That's a big range, right? I definitely say you want to be above 550, but depending on the article you've read. So you'll see all sorts of ranges. I have people who are eating meat; they're deficient. They're like 200s, 250s, or something like this, and they're like, "How can you be deficient? I'm eating a bunch of meat." I'm like, yeah, you're not getting a lot in you. So that's interesting. If that's the answer to the question, hopefully.
Yeah, and for those of you listening, was that helpful? Let us know, because if you let us know what's helpful, we can do more of it, right? So let us know in the chat box if you found that explanation helpful, both from Dr. Phan's perspective, my perspective, and we kind of put it together, basically sharing with you the whole medical medium perspective. So we want to know that it's kind of what you want to hear from us. All right, so another good question that's showed up on the Facebook.
So in summary, lowering the fats, it sucks. No, I'm joking. I'm joking. It just brings it in. So
Yeah. All right, our next question is from Julie Mayers, and she says, I came off thyroid meds, T3 only, and while I feel fine, I have a low pulse in the mid 50s and swelled up with fluid, 6 pounds worth in 9 days. My GFR is over 110. Any suggestions to get that fluid down? I'm doing the morning cleanse, off of all no foods, giving up grains as well. I eat salad and steamed potatoes, cooked veg and potatoes the other for meals, and I have a few supplements. Yeah, so any thoughts for her?
well, kind of similar to the other question, you can get back on a lower dose if you want to try to kind of, if it's just really uncomfortable. You can also do some wraps. These talk about hose and stockings to kind of get that blood flow up a little bit. Um, some doctors will give you diuretics and stuff like this to kind of get that fluid off right away. But again, that's a temporizing measure. It depends on what you feel comfortable about doing. If you want to bring a little bit of reishi, I mean, maybe reishi would also help a little bit, but it's hard to say whether that's going to help or not. But the thing is, I don't know. You're on licorice. Would licorice be helpful as well? I mean,
On She is on licorice, yes.
okay. Yeah, so I would consider maybe getting back on a lower dose to see if that kind of stabilizes things a little bit because it's a lot of you put a lot of fluid on there, it's uncomfortable.
Yeah, totally. All right, our next question is from Susan Horan. She says, "What's the best way to control pain post a lung surgery? I'm taking Cal Poppy mostly and Geneva or the Genexa acetaminophen daily, and today is 2 weeks post surgery."
What kind of surgery was it? She didn't say.
She didn't say. No, she didn't say.
So it kind of depends on the surgery, but also I like even if it's not a clean ibuprofen's a little stronger. So if you can take it and you don't have an allergy to it or you have bleeding issues, you can alternate. The thing, even if it's a clean acetaminophen or paracetamol, it can affect the liver. It makes the liver tax a little bit. So if you can kind of alternate a little bit, that's good. Icing an area, if it's okay to ice, depending on, again, what surgery it is. Some bone surgeries, they don't want you to put ice on it because they want you to become more inflamed so that it comes and kind of granulates the tissue. So it's been this far out. You could try some ice. Some people like heat because it relaxes the muscles around. It depends, again, what it is. And if it's an open wound, a closed wound. Consider homeopathy. Muneeza is an expert on that one. There's different types of homeopathy that you can use.
Yeah, I just wanted to post up this nice little comment here. So nice to see you both, says Tasha. I'm in a program with both of these amazing teachers. Highly recommend learning from them. Thanks, Tasha. It's amazing to have you in our programs as well. And love, love, love the work.
Thanks, Tasha. How much I owe you? I'm sorry.
Checks in the mail. Thank you, thank you. All right. So we have some lots and lots of questions coming in. So I want to make sure that we're addressing them. So I just want to wrap up Susan's question. So we talked about pain meds, and I think that Cal Poppy sometimes isn't enough. So from the medical medium perspective, bringing in curcumin, nettle leaf, MSM, lemon balm, all are supportive for pain. But also, Dr. Phan, you were talking about homeopathy, and if it was right after surgery, I would have suggested arnica. And if you have to do because when there's an injury and you take care of it immediately, arnica is the best way to do that. So bringing in arnica is super helpful, right? And the 200C is super helpful. When it's prolonged, it depends, right? It could be a number of different types of homeopathy depending on the presentation of the pain, frequency of the pain. Is it constant? Does it come and go? So all of these factors get taken into account in homeopathy. So I wouldn't know exactly what to suggest. Plus, I'm not a homeopath, but I know enough. Like my grandfather was a homeopath, and my dad was he used to dabble in homeopathy. So I've been around it my whole life. So,
But if I had a question, you're my homie from homeopathy. Yeah.
yeah, I mean, if I had a question to suggest, yeah, sure. Like, coughs, colds, flus, homeopathy is so good for, and acute things. I think homeopathy works really well. So, yeah, sure. But you need to know a little bit more to get the right remedy. Okay, let's jump back to our other thread on Instagram. So trying to find a question that's suitable for you, Dr. Phan. So Scoutalicious says, my doctor wants me to do a colonoscopy. Didn't we answer this one last time? What's an alternative?
I think we did. You might have to tune into the last one. Yeah.
Yeah, I thought we did, but they asked it again. So Scoutalicious, there's quite a few people who asked that question, by the way. So she actually ended up doing it without the solution. She said she drank 2 gallons of juice, lemon water, coconut water. Then the day before the procedure, drank lemon water, aloe water, coconut water, apple juice. And when it was time to drink the laxative, she drank Epsom salts, 2 to 4 teaspoons and 8 ounces of warm water. And then at 4 a.m., she said when she's supposed to drink the rest of the solution, she did 8 ounces of aloe coconut water, and it was a success. So in case anyone wants to know from personal experience.
Yeah.
All right. So, okay. So coming back to this question. All right. There's so many questions, Dr. Phan. So jump in, see one. Let me know that you'd like to sort of go for.
Well, okay. So there's a few of them here. Let's quick skin tags, liver issues, right? Skin tags are commonly seen as a sign of insulin resistance, but that's causes sluggish and stagnant liver. So work on the liver.
Liver for skin tags for those of you struggling. What about this question up on the screen?
35-year-old drinking 16 ounces of celery juice and throat was swelling and painful before and after. Doctor said she's allergic to celery. I don't think so. I think you might go slower. Maybe you do cucumber juice instead because the celery juice is just killing things or releasing things so fast. So there's this questions all the time when people have a histamine reaction or MAST, where they're like, I can't take any of this good foods because every time I take this, I have this reaction. I'm like, well, that means that the food is healing it. It's pushing things out. It's killing things or pushing things out. So you have to go slower or find something else that you can do to start removing toxins. And at a point in time, you'll be able to bring some of these things in. When? I don't know. It depends. Work with a practitioner.
Yeah, I agree. So there's another question from Ann88. She says, hello, Dr. Phan. I'd like your advice on ways to receive painkillers from an MD. I've been to 7 different docs in the last years. I've had multiple blood draws, MRI scans, CAT scans, ultrasounds, more examination, and I turn out to be healthy according to the conventional world, but I am far from healthy. So she said that today I had a session with Muneeza and I was advised to use painkillers to avoid being on adrenaline from the pain. The mild painkillers of the chemist are not strong enough, so she was on Tylenol and ibuprofen. Do you know ways or have advice to get stronger painkillers when doctors aren't supportive or understanding?
It's difficult because, a lot of people have to turn to illicit drugs to do this. And I don't recommend that because you don't know what you're getting. It's dangerous, whatever it is. And they'll label you as a drug user, basically. This is a big fear because of the opioid crisis, the whole issue with that. Doctors are now more, reluctant to give medications. In fact, it's harder to give. Doctors have to use certain forms. You have to use electronic prescription sending and all these different things. So they'll typically peddle you off to a pain management doctor. The pain management doctor is seeing all of these drug seekers and normal people who have real legitimate pain. And so they have to be very careful about how much they dole out. Otherwise, they may get litigated against. So you have to prove that there's a reason why. But if there's a vial issue, you really can't. It's really hard to image or see it somewhere, right? So in those cases, if a pain management doctor won't help you, because let's say you have fibromyalgia, in that case, it's best to see a rheumatologist and get a diagnosis and have the rheumatologist try different things. And of course, you don't want to come off as like, I need some pain medication, I need pain medication. You don't want to do that. You want to say, look, I've tried all these different things, and they really think they think it's mental or supratentorial, but in reality, I'm in pain. I don't want to be in pain medication. I really don't, but I don't want to be in pain either. And because I want to get off eventually. And so maybe the rheumatologist could say, look, I'm going to give you this. They'll typically try you on some antidepressants. One of them is like Cymbalta. It's been known to be helpful in fibromyalgia. But there are all side effects of these medications. So the hope is that you're on it temporarily until you can manage your adrenals and work on protocols that will help suppress the inflammation and the pain thereof. But you could try a pain management doctor. You could find a rheumatologist, and if that doesn't work, find a doctor or a nurse practitioner or a physician assistant who has some compassion, because they want to help you out. And if they see that you're not being a jerk or trying to manipulate the system to get medications, then they'll try to be there. And you have to come often and show them, like, I'm ready to do drug tests, I'm ready to do whatever, just to show in good faith that I'm really in pain. I'm not necessarily trying to game the system.
Yeah, I mean, she's bedridden, so I think it would be a question of trying to get someone over to her house or trying to get some support that way. She says that she had a brain injury and she had a really big metal pole hit her head, and she had a traumatic brain injury, and she's had several. And she said, and I'm reading from what she's written, she said that he told her that metal pole injuring her head would have no effect on her brain, and she's been left with almost permanent headaches.
Yeah. I mean, the thing is, it's your word against his or her, or whoever doctor is. And you have to find somebody who's going to, I mean, it's hard, because not doctors will see you or they can't get to you or whatever it is. But you have to keep on looking for somebody and bring in the angels to find somebody who will help you and write a prescription for you. It's difficult depending on what state you're in, because I can't write out of state narcotics and stuff like this. So you want to find somebody who can try to work with you.
Yeah. So important. So important. So if you're all just joining us right now, thank you for hanging out with us. We've got more questions that we're going to answer. Meanwhile, if you would like to, uh, you know, get your question answered, be sure to post it into the chat so that we can see it and answer it. Jane, I answered your question in the chat. I posted the link to my, hold on, I didn't post the correct
Golden
link.
Seal eye wash.
Golden Seal eye wash. It's on my blog. And if you guys are not, actually signed up to my newsletter, I highly suggest that you sign up, because right here in the corner, there's you'll see the link to the QR code for the Ask the Doctor program that starts tomorrow. But if you'd like to sign up for our newsletter and just kind of get on there, just scan the code right there and join us, because it's free. We send it out every Friday with awesome health tips. Right now, we're in the middle of doing a series on emergency support and emergency prep, and so many of you have asked us about that. We expect some kind of emergency events to be happening this year. They've put it into the system already. Lots of talk about this at the World Economic Forum. So, we've been doing a series on that to help you guys out. So if you want more of that, go check that out and sign up to the newsletter. And coming back to a few more questions that we have time for today. So how would you break it? As somebody asked, Wendy is asking, how do you break an antibiotic cycle for UTIs? A lady in her 50s has been having them every month, and she's had them since childhood, but she's been following for 3 years now. It got better at first, but now it's increasing in intensity, and she's on antibiotics monthly without them ending up in the hospital. And if she doesn't take them, she's in the hospital on IV antibiotics for her UTIs. So any thoughts on that?
Yeah, that's difficult because she's probably colonized by now, and she's colonized with multi-drug resistant or drug resistant strands of the bacteria, and they would temporarily help, but now she's had to rely on IV stuff. So, are you doing golden seal shock therapy? Are you doing golden seal like for 4 weeks instead of 2 weeks on, 2 weeks off, 4 weeks on, or something like this, 1 week off? Depends on, again, a practitioner, Muneeza, could probably help you better, but you would be doing the golden seal more probably higher dosing and more longer term, and then adding D-mannose, right? Some people will actually get Elura, which is the urologists don't like D-mannose. They like Elura, which is a cranberry supplement. It can help in some people, but I think it's a matter of really knocking down the pathogens and stuff. That she's off of the no foods obviously now. Hopefully she's not maybe off grains too, because some people have to go that full measure to get off grains to not allow the bacteria to kind of have a nice place to kind of stay and be. So those are the things I would think about. Mullen, Eyebright, these other ones that are in the protocols or in these books.
Yeah, yeah, that's a tough one. That's a tough one. A great question about blood pressure. Um, what's Dr. Phan's take on high blood pressure and reversing
Yeah,
it?
so liver sluggish, right? So every guy in my family, paternal side, my dad, his three brothers, my brother, maternal cousin, high blood pressure. There's one quack in the family who doesn't have it. So why? Because liver, I mean, celery juice and cleaner eating work on the liver. And it may take some time because you've had 20, I don't know how old you are, but 20, 30, I mean 2, 3 decades of stuff that build up in the liver. Not to mention ongoing adrenaline, cortisol that's going to be dumped into the liver if you don't, if you're always producing it. So that's one thing. Will sciatica ever go away? It can. Again, it's shingles. It takes a long time. It's really frustrating because it's painful, and you're doing all the protocols and it's not going away. But again, what is feeding it is this wave of adrenaline feeding it, or do you have a really like a nasty version or two versions of it, two, three versions of it that just don't want to go away? High level practitioners get hit by sciatica, so it's not like you're alone. It can be healed though.
Yeah, that's a really good question. So another question is from Mary McLaughlin. She says, I can't take iodine in any form, not even dulse, or I have extreme heart palpitations racing. Can I still heal without it?
Yeah, I think you can. I mean, you probably get iodine elsewhere. I mean, here's the thing with iodine, right? Some people say in the thyroid world, iodine helped me so much, and then other people say iodine hurt me so much. Why? Iodine kills things. Iodine, betadine. You've heard of betadine. Betadine kills pathogens on your skin or whatever it is. You put iodine in, and you start killing pathogens. How much you're going to kill? If you release so many at once, you're not going to feel so good. So you have to go slow, really slow, right? There are trace amounts of iodine in other foods and stuff like this until you can cleanse the liver out and other, support the adrenals, obviously, but the liver. And then you could probably bring it in again and push that pathogen load in different ways down.
Yeah, yeah, of course. So I agree with that completely. You can heal even if you don't take iodine. There's many ways to heal. So keep on keeping on because there's so many tools. Medical medium protocols are built in a way that you don't have to have just one tool to heal, right? Or there's not like one critical tool. You can use the other tools to help you if you cannot take that one. If you have a true iodine allergy, there's many people who do. They don't touch iodine ever, but you can still heal. So, and I've had clients with true iodine allergies never touch iodine and still get better. So this is Christina Borgestad. She's rising from the ashes on Instagram, and she's been really struggling. And she's saying, "What is the best to take when you do struggle with long plague and ME, which is basically neuroadrenal fatigue?"
Yeah. I mean, yeah, we go back to, okay, here's the thing, right? I'm near Houston, and we have two institutions near us, Baylor University and UTMB, University of Texas Medical Branch in Galveston, and they have two COVID clinics, and they haven't figured it out yet, right? This has been a few years now, and they're still figuring it out. They're thinking, oh, it's serotonin pathway. Anthony has told us what causes long COVID, which is, again, reawakening of the Epstein-Barr virus, affecting the vagus nerves, right? So you really have to keep on working on those protocols. But if your stress level is so high, it's a slow process. It's a really slow process because the adrenal cortisol just throw you off, and you're having symptoms and stuff like this. But if you can work on the protocol in the book, you know the protocol, Christina. But it's just a matter of finding a place where you're not always triggered by whatever is going on. I don't know what your personal situation is, but it takes time, and we have doctors who still not cannot work because they got the plague and they can't recover from it.
Yeah,
So
you know, here's the thing, Christina. I completely agree with Dr. Phan. And basically, this plague is designed to hit your immune system. It's designed to take it down. It's designed to attack the immune system, designed to pull it down, designed to make it hard. So the trick has to be to support your immune system. And ME is hard anyway. I've had it, you know, it's it's horrible because you are stuck, you're bedridden, you cannot function. And it's cranial, it's neurological, and adrenal, right? Because if you have one, you've got the other. If you have neuro, then you often always have adrenal fatigue too. So with this, I would say it's a long-term plan on healing the immune system. And for that, it's building, 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 doing rounds of Z shock therapy, rounds of C shock therapy, rounds of golden seal shock therapy, rounds of propolis shock therapy, rounds of time T shock therapy, taking the total immune blend supplement to support your health. Um, you know, propolis, so critical for neuro stuff and brain inflammation. Um, and so doing propolis shock therapy, for example, um, bringing in curcumin, which attacks, against brain inflammation. And all of these tools will help build the immune system, but so will things like burdock root, which boosts your white blood cell count, right? And pomegranate juice, which will boost your white blood cell count and your red blood cell count, and cherry juice, which will strengthen your blood, and things that will strengthen you from within, like red clover tea will give you more stamina. We were recently in a practitioner call talking about a herb that Anthony has talked about a little bit in the past called gynostemma. And gynostemma gives you strength and stamina to build back. I've given many people red clover and gynostemma, and they have seen improvements in their strength and ability to fight back. And even though it doesn't, there's so many qualities to energy in our bodies. So for example, somebody just asked, like, does celery force give you energy? And I said it helps brain fatigue, which is different than adrenal fatigue. Like, your brain is slow, but you have energy and you can move around, you can do your stuff, but your brain's not working. Dr. Phan, I'm sure you and I have both. I know I have had brain fatigue at times. I'm like, oh my God, I can't think or whatever, right? So the brain kind of slows down, and celery force can help with that. But there's so you can have, like, having been on Mattress Island, there's a feeling of like complete weakness. Like, you can't function, you can't move, you can't walk, you don't have strength, and fatigue that hits you so hard. So you have to build these different areas, Christina. You have to build in the where that strength comes in, right? With the herbs like red clover and gynostemma and nettle leaf, the adaptogenic herbs. So you really want to bring the adaptogens in when you're struggling with your strength and immune system. And then you want to bring in the adrenal support herbs like the licorice root and the ashwagandha and the adrenal health formula. So it's like when you're looking at a case, you have to look at all these different elements in order to put it together so that somebody can take those next steps and feel like they're making progress, right? So I hope this helps. I know you've been struggling for a while, and I hope that it makes a difference to you with some of these tips.
maybe even if you can do IV vitamin C, you can find a practitioner who can help you with that.
Yeah, that can also make a difference. I know you're in Scandinavia, so I don't know if it's easily available to you, but that would be something that you can do. Um, all right, so I know we're headed towards the end of our session. Do you have room for like one more question, Dr. Phan, or?
Sure, why not?
Okay, why not? So Um, let me pick a good one. um, there's so many good ones. It's so hard to pick. All right, so Gen
Yeah.
9. Both my boys have a tic, eye blinking, shoulder shrugging, and throat clearing, which is probably from heavy metals, I'm guessing. Is there a supplement or homeopathic remedy that could help while we are healing?
You're doing the heavy metal detox smoothie. You got magnesium and maybe some neuromag in. Um, I don't know, minis. What would you throw in there?
Um, I throw a lot more magnesium, neuromag, yeah, neuromag and mag glycinate. I agree with you 100%. Um, I'd probably throw in a little bit more, maybe ginkgo as well, and gotu kola. So ginkgo and gotu kola are two herbs that are very helpful for brain neuro issues, giving some relief, especially gotu kola. It's by Gaia Herbs. So I hope that you
What do you think about skullcap? Would that be?
yeah, skull cap too can provide a little relief. Another one is celery force. It can provide some relief as well. So try those out. And cal poppy. I would do a little bit of cal poppy. You can't do too much. I don't know how old your boys are. You have to be a little careful. So follow the shock therapy guidelines in the Brain Saver book for kids, and follow those. Those will make it easier and better. All right, guys, that's all we have time for today. Thank you. Your questions are awesome. I know we want
Yeah.
to answer them, but Dr. Phan has a patient schedule, and I know he's able to sort of come on and help us out and talk to us and answer our questions, which is amazing. If you have not signed up to our newsletter yet, there's a link. Please sign up. It's free. You get great information. We never spam you. We always send out some hard hitting health journalism in a way. So I hope that you will check it out. And Dr. Phan, thank you for being on this call. And tomorrow we do Ask the Doctor. So he'll be on there. We'll have other of our other doctors on there as well. If you are interested in joining this panel, there'll be 4 calls in the year. Tomorrow's the first one, and we have one every quarter of the year. So it's going to last a while. But you get to come in and ask really good questions and listen and gain answers and insights, right? So even though we won't have time to answer every single question, we make sure that we're answering questions to make sure that people are getting the kind of support they need. Because a lot of the questions that we're wanting to answer are what to do with medications, what to do about surgery, what to do about pain, all the medical stuff. And doctors are there with their specialties and their knowledge. So I hope you'll come in. I hope you'll check it out, because it's designed for you. You guys love these Q&As, and that's why we created a place where we could go more in depth, because here we're a bit limited. And
Yeah, and I get to cuss more.
yeah, he gets to cuss more. He wants to be more of himself. So anyway, thank you all for joining us. It was so fun to do the Q&A today. I will be posting the link, and we will see you on the next one. So we'll be doing these more regularly. Check it out. And I'll talk to all of you. See you on the interwebs and the Instagrams and the Facebooks and the YouTube. So thank you. Go follow Dr. Phan. He is right here. His handle is MD with Spirit. Go check him out on YouTube and Instagram. Follow. And we will see you very soon. Bye, everybody. Thanks, Dr. Phan. Mwah.
Thanks.
Bye.